Hello, scholars. My name is Dr. Karis Dillon, and the goal of this channel is to make academic subjects easier to understand. In the last video, we covered premenstrual dysphoric disorder. In this video, we're going on to anxiety disorders. The first anxiety disorder will be called separation anxiety disorder. In order to be diagnosed with separation anxiety disorder, the individual has to have the following symptoms. The individual has an enormous fear of leaving the people they feel comfortable with. This excessive fear does not coincide with fears that peers normally have at that age. The individual has to have 3 of the following symptoms. 1, the individual has extreme anxiety at the thought of having to leave individuals they are attached to, but also when they actually leave them. 2, the individual may worry tremendously when the attachment is gone and believe that something bad could have happened to them. They could be injured, they could be in some sort of disaster, or they could have died. Number 3, the individual may worry about getting lost, kidnapped, being in an accident, or another person becoming ill, which would separate the attached person. Number 4, the individual may refuse to leave home or to go out anywhere, even with the major attachments. Number 5, the individual does not like to sleep away from home or to go to sleep without being near an attachment person. Number 6, the individual might have nightmares about being separated from their loved ones. Number 7, the individual may complain about their body hurting, themselves having headaches or stomach aches, feeling like they might vomit when they're away from their separated person or their major attachment. Number 2, the individual will have constant fear, anxiety, or avoidance of a new scenario that presents itself. This tends to last 4 weeks in children and in adolescents, and then typically about 6 months or more in adults. Number 3, this causes the individual great distress, and they aren't able to function properly in their work, occupations, academics, or in other areas that are needed. Number 4, the distress is not the result of medication, substances, or a medical condition that the individual has. The distress cannot be better explained with various disorders like autism spectrum disorder, agoraphobia, anxiety disorders, or other psychotic disorders. The child may not like to stay in a room by themselves. They may follow around the other attachment and even attempt to sleep in their bed for comfort. When children are separated from those they are attached to and trust, they may go through social withdrawal. They may have fear of monsters or animals. They may be afraid of the dark or certain types of play. As the child grows older, they may become afraid of kidnappers, planes, car accidents, muggers, burglars, clowns, or any situation that could present danger to the family. Many times children do not like school because they have no one they can attach to, and because of this, they will not probably do very well. Sometimes when children really don't want to leave their loved ones, they can get very aggressive. When children are in the dark alone, they have weird perceptions of objects, of people. They may be frightened by what they believe as people are sneaking around their room, or ghosts or monsters are in their room, and that they can see them and others cannot. These children might seem like they are in need of constant attention and are extremely demanding. This can become a source of frustration within the family as everyone tries to comfort the individual or make them stronger in their own type of way. In a 12-month time, there are 0.9 to 1.9% of children who appear to have separation anxiety. Separation anxiety decreases as children age. This disorder is found equally in both females and males. Generally, as children go through this, they have periods of exacerbation and times of remission. So they'll have times where it comes back to them, maybe in different form, or it will begin to go away. Most children will later have trouble remembering their own separation anxiety, which is probably to their benefit. When separation moves into adulthood, there can be times where it's difficult to leave an adult because of a new relationship. They may feel that that adult is their attachment figure, but they get into a new relationship and they just don't want to seem to leave that adult, their safety person. There may be a little increase in rates of suicide for those that suffer from separation anxiety. If a child has this condition, it limits independence and as well as activities away from home. There are many other forms of anxiety that can coexist with separation anxiety disorder or may come about later in life. Someone with separation anxiety disorder will need to make sure to watch for these conditions or others around them. Generalized anxiety disorder, panic disorder, agoraphobia, contact disorder, social anxiety disorder, PTSD, illness, anxiety disorder, bereavement, depression, and bipolar episodes, ODD, which is oppositional defiant disorder, psychotic disorders, and personality disorders. Well, this is the end of our video. I hope this helps. It's kind of interesting that separation anxiety disorder cannot be only for children, but that adults can suffer from it as well. Of course, it's mostly a childhood illness, but it can come about in adulthood. I hope you like these videos and I hope you continue to watch. I really enjoy putting them together and hearing that they're helping you with different tests and such. Thank you very, very much, and I appreciate it. Talk to you soon.